everyone, I'm Anastasia. I welcome you all to this new session of Fundamental of Nursing. So in today's session, we are going to discuss about a very interesting topic, which is the body position. So here, maintaining a good body position is very important, right? Especially when one is suffering from any disease condition, he or she will be striving to enhance their comfort level. So by providing various body positions which will be suitable with their disease condition will help the client feel at ease. So in today's session, I am going to teach you about what are the various body position which you can provide to the client depending on their disease condition, as well as when you are performing physical examination, what are the various position you can tell the client to take in order to make it an effective one. So here, posture is the alignment of the body parts to one another at any given moment. It involves a complex interaction between the bones, muscles, connective tissue, nervous system, and the skeletal muscles, both in the central and peripheral. So, in order to get a clear idea of this topic, let us now first move to the definition of body position. Body position is defined as placing the person in proper body alignment for the purpose of promotive, preventive, curative, as well as rehabilitative aspect of health. So in simple words, this body position, the first one is to provide comfort to the patient. The second is to relieve pressure on various aspects of the body. By providing a good body position, it also helps to improve the circulation. It prevents formation of deformity. It also allows us to carry out various diagnostic procedures. It also allows us to perform various medical as well as surgical intervention for the patient to prevent pressure ulcer, as well as to promote the proper body alignment, as well as to conduct the delivery of a child. So these are the purpose of positioning. So what is the principles of positioning? The first one is to maintain a good body mechanics. The second is to obtain assistance if it is required. We should also ensure that the mattress which we are providing to the patient must be firm and must be at a level where it will be easy for the healthcare provider to provide care for them. We must ensure that the sheets which is provided is clean and dry, as well as we must avoid placing the body parts directly over another in order to prevent pressure. We should also plan a regular position changes schedule for a patient for 24 hours. We should make sure that the patient is comfortable, as well as we should perform hand washing before and after we perform this procedure. So these are the principles of positioning. Now moving on to the next is the general instruction. So what are the various things that a nurse must keep in mind before they tell the client to take the required position? The first one is to maintain a good body alignment of the patient at all times. The second is to support the body parts in good alignment by the use of various comfort devices. The third is that we must make sure that we avoid prolonged flexion of any part of the body by changing the position at least every 2 hours, and also to reduce the pressure by the body weight. So as a nurse, before we provide any position to the client or before we encourage the client to take a certain position, we must make sure that all these things must be kept in mind. So before you decide which position the client must take, you must first perform the preliminary assessment. So here what you will be doing is that you will be checking the patient general condition, as well as the physician order. You will also assess their self-care ability. And after you have done this, if you feel that they require any comfortable devices, then you must make sure that you arrange it. You should also identify the deformed extremities so that you will get a clear idea of what position you can tell the client to take in order to promote their comfort level. As well as you must always identify the rationale before you advise the client to take that particular position. So these are the various things things that you need to assess before you decide which position the client must take. So because here you have assessed the condition of the client, you will be getting a detailed idea of what are the things the client may require, right? So here, before you perform this procedure, you should make sure that you arrange all the articles as required by the client, and this can include extra pillow, mattress, adjustable bed, bedside rails, trapeze bar, sheets or sheet rolls, as well as comfort devices such as backrest, footrest, sandbags, bed cradle, cardiac table, etc. So here you must make sure that before you perform the procedure, you must arrange all the articles, all the equipments, all the devices which may be required in order to enhance the comfort of the client. So here there are various positions you can provide or you can tell the client to take in order to enhance their comfort. The first one is the dorsal or the horizontal recumbent, or even commonly known as the supine position. The second is the dorsal elevated or the semi-recumbent position. The third is the prone position. The fourth is the lateral or the side lying position. The fifth is the Fowler's position, and the sixth is the cardiac position. So now let us discuss about each and every position in detail. Starting with the first one, which is the dorsal, also known as the horizontal recumbent or even the supine position. In this, the patient will be advised to lie flat on the bed with his legs together. His head may be supported by the pillow, and his legs can either be extended or flexed. And if his knees are flexed, then we can also provide a small pillow under the knee in order to enhance the comfort of the client. Rings under the elbow and the heels, as well as the air cushion under the buttocks, can be provided in order to prevent them from developing bed sores. And in case if the client is bedridden, then footrest can also be provided in order to prevent foot drop. So here, when the physician has advised the client to take the supine position, this is how it must be done. The second one is the dorsal elevated or the semi-recumbent position. So here what you will be doing is that you will be telling the client to lie in the bed with two or more pillows arranged in the armchair fashion in order to support the shoulder, the arm, as well as the elbow of the client. And this position is mainly provided to patients with minor respiratory distress, because in this manner it will enhance their breathing pattern. The third position is the prone position. So here what you will be doing is that you will be advising the client to lie on his or her abdomen with her face turned to the side and with one small pillow under the ankles. So here you will also be providing a pillow for the client to rest his head, as well as here one or both arms of the client must be at rest in a comfortable way, either beyond the head or at the sides of the head. This position is mainly used for patients with burns, injury, or those who have just had an operation on their back. This position is also used in order to enhance their comfort as well as to relieve pressure from bed sore prone areas. This is also given to client after anesthesia in order to prevent the aspiration of the saliva and the mucus. But in such situation, no pillow will be provided under the head of the client. So this is about the prone position, where the client will be lying on their abdomen, their face will be turned sideways, and there will be a pillow which will be provided for the client to support his head, as well as one small pillow which will support their ankle. And here we must make sure that one or both arms of the client rest in a comfortable position, either beyond the head or at the sides of the head. And the next is the lateral or the side lying position. So from here, you can understand that this is a position in which we will be asking the client to lie on his side with both the knees flexed towards the abdomen. And here one knee will be more acutely than the other. And when a client is advised to take this position, then we will be providing 4 pillows where one will support the head, the second will support the back, the third will be placed in front in order to support the abdomen, and the fourth one will be placed between the knees in order to take the weight of the upper leg. Here, a left lateral position is also the same as the lateral position, but here the patient will be placed on the left side with a pillow under their head. And here we usually advise the client to take this position whenever we need to give enema suppository, when we need to take the rectal temperature, or even to perform the rectal examination. So the next one is the Fowler's position. So this is the more erect position in which the effort is made in order to maintain the position of the client in a sitting position as nearly upright as possible. So here what we will be doing is that we will be trying to make the client be in a sitting position where we can use certain comfortable devices such as the backrest or the additional pillows. And here the arms of the client should also be supported with pillows in order to make sure that the client sits with the arms supported in the armchair fashion. Air cushion can also be provided under the buttocks in order to prevent pressure over the sacrum. And here the knees may also be raised over the pillow in order to prevent the client from slipping. This position is used whenever the drainage of the abdominal cavity is desired to localize infection, for example, peritonitis, to relieve the breathing difficulty, also known as dyspnea, to relieve tension on abdominal sutures, as well as to relax the large muscles of the back. So moving on to the next, which is the cardiac position. So this is a position whereby we will be placing a table in front of the client along with a pillow on which the client can lean forward and take rest. The client can be provided with an air cushion so that they can sit on it, as well as a small pillow under the knees. And this position is commonly advised for clients suffering from any cardiac condition who is having difficulty in breathing when they are in a supine position, because through this position it helps to make use of the extraordinary muscles of respiration. And changes of position is also important in order to relieve fatigue as well as prevent embolism. So these are the various positions which you can advise the client to take in order to enhance their comfort. Now moving on to the next, we will be discussing about the positions that you can advise the client to take whenever you need to perform the physical examination. The first one is the dorsal or the horizontal recumbent. The second is the dorsal recumbent position. The third is the erect position. The fourth is the Sims lateral. The fifth is the lithotomy position. The sixth is the knee chest or the genupectoral position. And the last one is the Trendelenburg position. So here the first one, which is the dorsal or the horizontal position, is the same as the dorsal position which we have discussed about in the first, that will help to improve the comfort of the client. But here, no extra comfortable devices such as pillows, footrests, backrests, air cushions will be provided. And this position is mainly used for head to foot examination. So whenever you need to perform a head to foot examination, you can advise the client to take this position. And then moving on to the second one, which is the dorsal recumbent position. So here we will be asking the client to lie on their back with their legs separated and their knee flexed, and we will be providing a pillow under the head of the client. This position is mainly advised to take whenever we need to perform the vulval-vaginal as well as the rectal examination, as well as when any operative procedure is required in these vulval areas. So here, whenever we need to perform the vulval, the rectal, as well as the urethral examination, or whenever any operative procedures needs to be done in this area, then this is when we can advise the client to take this position. And the next one is the erect position. So here from the name itself, you can understand that this is a type of position where we will be telling the client to be in a normal standing position with both of their feet on the floor. Whenever any orthopedic or neurological procedure needs to be performed for the client, this is when we tell them to take this erect position. The next one is the Sims lateral or the left lateral prone position. Here, what we will be doing is that we will be telling the client to lie on his left side, and we will be providing one pillow where they can support their head with the left cheek resting on it. And here, the left arm will be drawn behind the back, whereas the right arm may be in any position which will be comfortable for the client. And the right thigh will be flexed against the abdomen. So this is a position which we will tell the client to take whenever we need to perform any vaginal or rectal examination. The next one is the lithotomy position, where we will be telling the client to lie on their back and we will be providing a pillow to support their head. We will be advising them to separate their legs and to flex their thighs on the abdomen, and here the patient buttocks will be brought to the extreme edge of the table and the legs of the client will be supported on the strips. So as you can see here in the picture, this is what lithotomy position is. However, when we are advising client to take this position, if their calf muscles are pressed or if their position is prolonged, then it can also lead to embolism. This position is mainly used for performing the gynecological examination as well as for providing any treatment during the surgical procedure involving the genitourinary system. Then moving on to the next one, which is the knee chest position. Here we will be advising the client to rest on their chest and their knee. The head is turned to one side with the cheek over the pillow. A small pillow may also be placed under the chest, and here we will be advising the client to put the arms above the head or maybe flex their elbows and rest along the sides of the head so as to support the client partially. Here we should make sure that the weight of the body must rest on the chest and the knee. Here the knees will be flexed in a kneeling position and the thigh are at right angle to the legs. So as you can see in this picture, this is the knee chest position, and we will mainly advise the client to take this position whenever we need to perform the rectal and the vaginal examination. And it is also an exercise for the postpartum client. And then moving on to the last position, which is the Trendelenburg position. So here what you will be doing is that you will be advising the client to lie on his back, and here the foot of the bed will be elevated to 45-degree angle. And this position can only be taken in the operation theater, whereby there will be an operation table which can be adjusted to this position. So here when the foot is raised to 45-degree angle, the head of the client is low and the body is in an inclined plane and the legs hangs downward over the end of the bed. This position is mainly used during the examination or even during the operation in the pelvic organs in order to displace the intestine from the pelvic cavity into the upper abdomen. It can also be used in ward in order to treat shock as well as decrease the blood pressure of the client. So this is why this Trendelenburg position is given. So now here we have come to the end of this topic, whereby in today's session we have discussed about what do we mean by body position, what is the purpose, principles, general instruction, as well as about the preliminary assessment. We've also discussed about the various positions which we can ask the client to take in order to enhance their comfort, as well as the various positions which we can ask them to take whenever we need to perform the physical examination. So I hope you have got a clear insight of this topic. I'll be meeting you guys in another session. Until then, have a good day. Thank you.